Hello, everyone, and thank you for joining us for today's webinar. My name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for joining us at our webinar titled Children's Health and Education Mapping Tool 101. The School-Based Health Alliance Mapping Tool is a great resource designed to support diverse users to identify geographic areas where disparities in child health, education, and socioeconomic status exist, and develop school-based strategies to address these disparities. We would like you all to help us count today. If you can use your chat box in the Zoom icon control panel, if you have more than one attendees with you, please type in your name plus the number of attendees that are with you. This will help assist us with the final attendee account. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based health care. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students already spend the majority of their time in school. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed. Behavioral health issues get quick, expert attention, and we all know that healthy students make better learners. Now we have a few housekeeping reminders. All attendees are in listen-only mode. However, we would love to hear your questions. So please use the chat box tool located in your Zoom control to put in your questions during the webinar. We will address questions following the presentation. Also, we do have poll questions that we would like for you all to just answer at the end of our presentation. This webinar is being archived and recorded, and the slides will be updated to our website in 1 to 3 business days. We will send you up a follow-up email with the link to provide you this information. Also, as you are viewing on your screens, we have other webinars that have been archived. Today's presenter is Haley Love. Haley Love is the Director of Research and Evaluation at School-Based Health Alliance, and she will be presenting on our Mapping Tool 101. Thank you, and I will now turn it over to our presenter, Dr. Haley Love.
Thank you, Tiara, and thank you everyone for joining us this afternoon for this webinar about our Children's Health and Education Mapping Tool. So I want to start with this image, which shows that health and education are deeply entangled. Like Tiara said, healthy students make better learners. But many youth in underserved communities come to school carrying burdens such as hunger, anxiety, and depression. They've experienced adverse childhood experiences. They live in unsafe or violent neighborhoods. All of these social factors preventing them from learning to their greatest potential. They're more likely to have trouble focusing in class and much more likely to be absent. So for those of us who are interested in creating the conditions that remedy the inequitable distribution of these powerful social factors, we need data-informed strategies led by health and education leaders, community partners, and youth and their families. And that's precisely why we created this resource called the Children's Health and Education Mapping Tool, to allow data to help be a part of decision-making and priority setting within communities. So what is the Children's Health and Education Mapping Tool? It's a GIS mapping tool designed to support diverse users to identify geographic areas where disparities in child health, education, and socioeconomic status exist, and develop school-based strategies to address these disparities. So what can you do with the tool? Data that are traditionally mapped in separate silos can be searched, mapped, downloaded, and compared to national averages. Users can view the locations of school-based health centers, schools, and community partners and strategically plan for future expansion of SBHCs. What are the data sources for the tool? The mapping tool pulls together several publicly available national data sets along with our 2016-17 National School-Based Healthcare Census data set. The federal data sets include the US Census Bureau's American Community Survey, the National Center for Education Statistics Natality Files, the CDC's Diabetes Interactive Atlas, the CDC Atlas, the USDA's Food Atlas, the Comprehensive Housing Affordability Strategy Data, FBI Uniform Crime Reporting, and as I mentioned, the census. So a really diverse set of data sets pulling from different corners of the government, looking at different aspects and factors that influence health and education. So what indicators are included in the tool? We group the indicators in the tool into 4 domains. They include health insurance and coverage indicators. So that includes the number of children who are uninsured or underinsured, health indicators like food insecurity, obesity prevalence, teen birth rate, education indicators such as the number of children or number of individuals over the age of 18 who don't have a high school diploma, and demographic and socioeconomic status indicators related to poverty, crime rates, etc. All of this is going to come to life momentarily when I show you in the tool. So what are some of the limitations of the data? It's important to know that the county level data is the smallest geographic denomination with good data across all of these data sets. But the indicators may vary within a county, such as at the neighborhood level. I'm sure if each of you thinks about the county that you live in, there's a lot of variability within that county. But if we wanted to be able to pull data from all of these different data sets, the county level was the smallest geographic denomination that we could use. The data may be from different years, outdated or missing, but it is updated as it becomes available. The tool cannot explain causation of indicator values, and testing for statistically significant differences is not available in the tool. So to access the tool, anyone can use it by coming to the Alliance's webpage, www.sbh4all.org/mapping tool. If you look in the right-hand column, you'll see a menu of options where you can find all sorts of information and helpful resources for using the tool. In About the Tool, you can learn about why this tool was created in the first place. In About the Data, you can read more about the data sets that are included in the tool. Data sources build on that, sharing more information. The user guide is a brief guide, which I'll show you momentarily, that shows you the basics of the tool. Under video tutorials, we've created a variety of tutorials and use cases to help familiarize you with the tool. And finally, we have frequently asked questions and the opportunity to ask us a question, and we encourage you to do so. This is the user guide that I mentioned before. The user guide maps out 12 key functions of the tool and where you can find them. I'm going to talk through each of these functions just now through 3 different use cases. But when you're back at your desks looking and using, trying to figure out how this tool can be applied in your setting, print out a copy of this user guide. It will help you move through the tool more quickly. So we also want to call your attention to a blog that we recently had published in Health Affairs about this mapping tool. It's called A Mapping Tool to Address Health and Education Disparities and Improve Access to School-Based Health Care. It maps out a bunch of interesting use cases for how the tool might be used in different settings. So now I want to try and bring everything that I've said to life by showing you the mapping tool and how you use it. So I'm going to go through 3 use cases this afternoon. The first is focused on expanding school-based health centers in high-need areas in North Carolina. The second use case is talking about integrating school-based health centers into a strategy to reduce unintended pregnancy in Arkansas. And finally, the third use case will be about identifying SBHCs in a congressional district in California who are using telehealth technology to expand access to services in schools. So I'm gonna switch over. This here is our web page where you can see the mapping tool and all those resources that I mentioned. And this is the mapping tool. So when you come to the tool, you'll see that in the upper left-hand corner, there are 4 different layers. The first is the children's health and education indicators. The second is the school-based health center and school characteristics layer. The third is the map my data layer. And the fourth is optional layers. I'm going to start in the children's health and education indicators layer and select the state of North Carolina. It's going to zoom in on North Carolina and show me the outlines of the counties in that state. Like I mentioned, there are 4 different domains of indicators that we include in the tool. As I click on this arrow here, it shows me the 2 indicators included within health insurance and coverage indicators. As I click on these boxes, you'll see different counties showing up in darker shades of blue. This sliding ball is automatically set to the national average. This means that nationally, 39% of children are on Medicaid and CHIP who are under 18 years old. If you click on this info button, you can see the definition of this indicator, the source of the indicator, and the national average. You can move these sliding balls in either direction if you're interested in, say, perhaps moving it to the state average for a particular indicator. The power of this tool lies in the ability to overlay multiple indicators of need. The kids and young people who live in underserved communities are often suffering from multiple areas of need or deprivation at the same time. The same kids who are hungry and obese are often the same kids who are becoming pregnant during their teenage years, are not graduating from high school. So this tool allows you to bring those different data sets together to identify areas of need. So I'm going to go ahead and start adding in additional areas of need so that you all can see where there are high areas of need in the state of North Carolina. I want you to focus your attention on the counties that are in darker shades of blue. Those are the counties that are underperforming on more than one indicator. I'm now going to add health indicators including teen birth rate, adult population percent obese. There's not a national data set on childhood obesity, so we use a CDC data set on the adult population who is obese as a proxy for childhood obesity. The total population who are food insecure, and the chlamydia rate. What you can see is a story starting to emerge as you look at this map of North Carolina, and you're starting to see counties starting to show up in darker shades of blue. And those are the counties that are underperforming on multiple indicators. Now I'm going to add in education indicators, the percent of adults with no high school diploma. And I'm going to add in the demographic and socioeconomic status indicators. So first I'll add in the percent of free and reduced lunch, showing you the counties where children are underperforming compared to the national average on free school lunch eligibility. Next, the percent of kids in poverty, the percent of kids in single parent households, the percent of households with severe housing problems, and violent crime rates. So here your story starts to emerge more clearly. If you scroll down to the coincident indicator summary in the left-hand corner, you can isolate the counties who are underperforming on multiple indicators. So I'm going to limit it to those counties, there are 17 of them, who are overlapping on 9 of these indicators of need, suggesting that there are high levels of need in these areas. The next thing I want to know is, are there school-based health centers in this county? I'm going to go up to the second layer up here, the SBHCs and school characteristics layer. Click on school-based health centers. And as I do that, you'll see school-based health centers start to emerge. They're green and brown dots. The green dots represent school-based health centers who completed the 2016-17 National School-Based Healthcare Census. And the brown dots represent school-based health centers who did not complete the census. So we know very little about them. As you scroll over the tool, you can see characteristics of the counties and the school-based health centers, which I'll show you momentarily. But scroll over any county and you'll receive a pop-up box like this one that shows you characteristics of that county. And let's say you want to see all of this data that's being populated in the tool. At any point in time, you can go up to the upper right-hand corner over here, click on Data and Analysis, and it will show you a data table, but you have to be under the Children's Health and Education Indicators layer. So make sure that you're on Children's Health and Education Indicators, click on Data Analysis, and it will show you a data table of all of the values for each of the counties, which you have asked the mapping tool to share. So going back to school-based health centers, click on any school-based health center to see characteristics. For example, this is Forest Hills Middle School School-Based Health Center in Wilson, North Carolina. It'll tell you the number of schools with access to the school-based health center, the total number of students eligible to use the SBHC, the grade levels served, the percent of students eligible for school lunch program among the schools served by the SBHC, the year it opened, its sponsor organization, its staffing profile, hours of operation, population served, and whether or not it has an electronic health record. So what you can see here is that in some of these counties with high levels of need, there are school-based health centers. So for example, down here, sort of in the western part of the state, there are school-based health centers in this area of need. But if you focus in here, on the right, in the eastern part of the state, very few of these counties underperforming on 9 indicators have a school-based health center. So we're going to focus on this as the area where we want to drill down and explore the expansion of SBHCs. The next question that you might have is, are there schools that could provide homes to school-based health centers? The next thing I'm going to do is click on public schools, and this is a very large data set. It often takes a little bit of time to open it, but what you see now are these blue flags that show the locations of public schools. And what you can see is that there are a lot of public schools that could be homes for school-based health centers. Let's say you wanted to drill down a little further though, and you wanted to identify the schools eligible for Title I funding. Or for example, you wanted to limit the schools to the grade levels served. Perhaps you wanted to think about school-based health centers in a high school. You can use these filters to limit the schools in that way. And finally, if you want to filter the schools by free school lunch eligibility, say you only want to see the schools that are underperforming compared to the national average for free school and reduced lunch eligibility, you can again move this sliding ball across and see that there are schools in each of these high-need counties that could be homes for school-based health centers. The next thing I want to know is, are there medical sponsoring organizations that could provide the health services in this school-based health center? So you're going to click next on the optional layers layer and click on healthcare facilities. You can add the locations of hospitals, federally qualified health centers or health center programs, rural health clinics, and substance abuse treatment centers. At any point in time, if you're curious, because the map is starting to get a little complicated, if you look to the bottom of the screen, you can see a legend which shows you the data that's included in the tool. So what you can see here, and we're going to zoom even further now and focus our attention in Greenville, near Greenville, and see that there are a variety of schools, including schools with students with high levels of free school lunch eligibility. There are hospitals and FQHCs that could serve as medical sponsoring organizations. If you click on these eyes, you can see more information about those health centers and hospitals. If you zoom in very closely, you can see the names of the hospitals, Pitt County Memorial Hospital, for example, or the name of the federally qualified health center. I have to zoom out a little bit, then zoom back in. This is a mobile dental van, federally qualified health center. And these could be your partners in starting a school-based health center. So this use case should have given you a basic understanding of the lay of the land of the mapping tool, of the layers of the tool, and how this tool could be used as part of a state-level strategy to expand access to school-based healthcare. I'm going to move on now to the second use case, which is going to be thinking about how to use school-based health centers as part of a strategy to address teen pregnancy in the state of Arkansas. Arkansas has the highest level of teen pregnancy in the US, and it also already has a vibrant community of school-based health centers operating in the state. So I'm going to go again to the Children's Health and Education Indicators layer and click on the state of Arkansas. This time I want to focus on 3 indicators. First, I want to identify the counties underperforming compared to the national average on teen birth rate. And what you can see is that every county, with the exception of 1, is underperforming. Next, I want to look at those counties where the percent of adults with no high school diploma is underperforming compared to the national average. Again, keep your eyes on the darker shades of blue. And finally, I want to look at counties where there are high levels of children in poverty. So I'm going to scroll down again to the coincident indicator summary and isolate the 64 counties in Arkansas that are underperforming across all 3 indicators. Again, you can click on any county to see information about the school-based, about that county, or click in the upper right-hand corner on data and analysis to see all of the data that's included in this table, in this map. At any point in time as well, you can export this data into an Excel file to play with. So my next question again is, we have all these areas of high need in the state of Arkansas. Are there school-based health centers in these counties? So I'm going to click on school-based health centers, and I see that yes, in some of these counties in Arkansas, there are school-based health centers, but many of them, particularly those along the Mississippi River, do not but there are very, very few school-based health centers in the eastern part of the state. So I'm going to zoom in on this area and go a little deeper again to see where there might be opportunities to expand school-based health centers. The first thing I'm going to do is click on public schools, and where I can see with the blue flags all of the public schools in the state. Again, you can use filters to isolate the schools to a certain criteria. So perhaps you're interested in the schools where the lowest grade level served is 6th and above, because those may be the schools where you may be trying to expand access to contraceptives or expand programs to improve or increase education about sexual and reproductive health services. Next, I'm going to do the same thing. I want to know if there are any health care facilities that could serve as the medical sponsoring organizations for the school-based health centers. I'm going to add the locations of hospitals, health center programs, and rural health clinics to start to create this picture of where there are areas of need, where there are schools, and where there are medical sponsors that could deliver the care in these school-based health centers. I'm going to focus here in Pine Bluff. And look at the schools here and this hospital and FQHC as potential partners. This is where all of the data in the tool is valuable to helping start the conversation, but truly it's the starting point. At this point, it's now about building on relationships, understanding the local environment and context, and using this data to help drive the discussion about why schools and school-based health centers may be part of a strategy to expand access to school-based health centers. So my third case study is from someone who recently contacted us from a health legislative aide from California's 21st Congressional District, who asked, are there school-based health centers in my congressional district? And do any of the school-based health centers in my congressional district use telehealth services? So we're gonna zoom in and look at the state of California. The first thing that this individual wants to know is, are there school-based health centers in the 21st district, congressional district of California? The first thing I'm gonna do is go to the health policy layer and put in the boundaries for the 116th US congressional district. I'm gonna zoom in so that we're focused specifically on California. And if I click on this eye, it'll add the numbers or labels of the congressional district. So here you can see California's 21st congressional district. Next, I want to know, are there school-based health centers? And are any of the school-based health centers using telehealth? If you click on show filters, you'll see that you have a lot of opportunities to look at specific characteristics of school-based health centers. You can look at SBHC sponsor organization types. Say, for example, you were interested in looking at FQHC sponsored school-based health centers in the state of California. You can click on FQHCs and you will see only those SBHCs sponsored by FQHCs. But that wasn't the question. Again, they wanted to know, are any of the school-based health centers in California's 21st Congressional District using telehealth services? So when you're using this tool, you can see that there are a variety of ways you can filter, other ways you can filter the data: hours of operation per week, populations served, whether or not the school-based health centers serves adolescents, the grade levels served, the delivery model, or whether school-based health centers are using telehealth. So we're going to first look at, are any school-based health centers, traditional school-based health centers, that are using telehealth to complement on-site providers. And as you can see, there are two. The first here is Raisin City Elementary School-Based Health Center, and the second is Parlier High School School-Based Health Center. Next, I want to know, are there any telehealth exclusive school-based health centers? Telehealth exclusive school-based health centers are places where 100% of primary care services are being delivered via telehealth. There is not a provider who is physically on site, but all services are being delivered via telehealth. When I click on telehealth exclusive, I can see that there are no telehealth exclusive sites in California's 21st congressional district. At any point in time, if you want to print your map, you can zoom in or zoom out, click on print, and print it as a PDF. If you want support and feedback, here's where you can go to access information similar to what's on our website: the user guide, about the tool, video tutorials, and the Children's Health and Education Indicators download allows you to download the data that's in the tool. So those are my 3 use cases for the mapping tool. Now I want to open it up to your questions. I'd love any questions you have about the tool, or if you have a use case in mind that you would like to see, please share it and we will walk through how we would address that particular use case using the mapping tool.
Awesome. Thank you so much, Haley, Vice President of Research and Evaluation. So while you answer your questions, we do have just a few announcements, and I'll send it over to my colleague, Maddie Ha.
Thank you. So we just wanted to tell you to please join us and become a member of the School-Based Health Alliance. We work to improve the health status of children and youth by advancing and advocating for school-based healthcare. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. Please take a moment after the presentation to visit www.sbh4all.org/membership for more information and to join. We also have released the dates of our upcoming National School-Based Healthcare Convention. In 2020, we're going to be holding it in Denver, Colorado from June 23rd to June 25th. And the call for abstracts are now open and the submission deadline is November 4th.
All right, thank you so much, Maddie. So now we have our first question. Is there a way to see FQHC service areas?
So there's the opportunity to see various service areas. And let me show you. I'm going to open a new link. So you can view the locations of health professional shortage areas for primary care. You can see the locations of health professional service areas for mental health. And you can see the health professional shortage areas for dental care. And you can also see the medically underserved areas by clicking on each of these options under health policy. If you look to the upper left-hand corner, you can see that we partner with an organization called Health Landscape, who created this tool. The first tool that they created is something called the UDS Mapper. And I would encourage you, if you want to see FQHC service areas, that you would click on Health Landscape, go to their UDS Mapper, and they have another mapping tool which will allow you to see a lot more specific data specific to federally qualified health centers, including their service areas.
Great. So another one of our questions is, will there ever be an opportunity to add custom data sets to create new layers for this tool? Also, what is underlying GIS software used?
Great question. So yes, if you look to this layer of the tool called Map My Data, you can add data points to the tool, any data point you would want to this tool. It's a fairly easy function to use. You click on Map My Data, you paste in your data set, and it will show you the locations of whatever it is that you wanted included in the map. If you go to our mapping tool webpage and go to our video tutorials, this tutorial called Use the Tool to Map Your Own Data Points will show you exactly how you can use the Map My Data Point function of the tool.
Another person asks, are there any case studies where the tool has been used to map youth tobacco use?
That's a great question, and I would turn it back to you to say, because this tool is as strong as its users, and so much of the feedback that you have provided us has helped strengthen the tool. Is there a national publicly available data set on youth tobacco use? And if there is, that's another data set that we could consider adding to the tool so that you could use it in order to overlay that as one of the indicators. Alternatively, if you have state level data, or if the data about youth tobacco use is at any sort of site level, say for example at the school level, you could use the Map My Data Point function to add any data set to this tool. But if you're aware of a publicly available data set that maps youth tobacco use, that would be wonderful if you could share that with us, and we could think about how we might integrate it into the tool.
Another person asks, I used to be able to search an address to find a school or center on the map. Can I still do this? Do I need an account to log in for this? Is there a way to view SBHCs that offer vision services / vision centers?
Good questions. Okay. So I think the first one was, I used to be able to search. There are some functions that don't exist anymore in the tool. And as you can see, it changed from its original, from the original tool that we had. That's something that we could consider adding back in as a function. It used to exist at the top of the screen here so that you could search any address, but then people didn't know how to get to a state. So to simplify things, we limited it to being able to search a state under the health and education indicators layer. But again, I would just encourage you to use Map My Data Point if you do know the address, in order to put the address on the tool. But if we receive feedback that is something that people want added back into the tool, we can absolutely do that, and we can try to find a way to sort of maybe put it over here in the lower right-hand corner so it's not distracting, so it doesn't confuse people in terms of how you start to use the tool to identify a state that you might be focusing on.
Another participant asks, I'm looking for FQHC-sponsored SBHCs that use telehealth in the state of Missouri. The political boundaries are not a factor.
Oh, I just want to make sure we answer all the questions from the previous one because I think it was like a 4-part question. So I think the next one was, are there vision services?
Are there vision services / vision centers?
So no, we do not have the locations of vision services included in the tool. That's a layer we could consider adding. We have, if you look under the school-based health centers filters, you can look at staffing models who are delivering care. And this absolutely does not answer your question. However, it might answer someone else's question about if I wanted to know if there was primary care or if the provider team was a primary care and behavioral health team or a primary care and behavioral health plus expanded care team. You can do that. Whoever asked this question, I would just encourage you to reach out to me. If that's a map that you're interested in seeing, I can fairly easily create that map just with our census data by using the map my data point data and just filter our census data to only include sites with vision services, and I'd be very happy to send that to you. So send me an email. I'll put my email address up on the screen toward the end of the webinar. Is there another question in that one?
Do I need an account to log in for this?
No, you don't need an account. Anyone can use this for free. You can create a login in the upper right-hand corner if you want to save maps that you've made previously. But in order to use the tool, it's free for anyone to use, and you do not have to have a login. You just go to our website, as I showed you before. Go to Resources, Public Resources, and click on the Children's Health and Education Mapping tool. And from there, you're able to get started.
All right, that was it for that one. If you want to go back to the one about political boundaries in Missouri, someone says that they're looking for FQHC-sponsored SBHCs that use telehealth in the state of Missouri, and political boundaries are not a factor.
Okay, so we're going to zoom into the state of Missouri. We're going to click on school-based health centers. As you can see, it looks like there are some school-based health centers in the state of Missouri who completed the census, but some who did not. So it is possible that there are more FQHC-sponsored school-based health centers in Missouri that we just don't know that that's their sponsor type because they didn't complete the survey. But there's my plug to complete the survey. So I'm going to go ahead and click on FQHCs and lookalikes. And here you can see that there are a variety of FQHC-sponsored school-based health centers in the state of Missouri who exist across the state. And now scrolling down, we're actually not aware of any FQHC-sponsored school-based health centers that are delivering telehealth exclusive SBHCs. But if we click on traditional with telehealth, yeah, you can also see that there are no traditional SBHCs in Missouri with telehealth either. So there's some exciting opportunity for expansion in that space.
Another question is, what is the underlying GIS software used for this tool?
That's a great question, and I don't know the answer. I would encourage you to click on Health Landscape, and you can learn a bit more about Health Landscape as an organization and the GIS software that they're using to sort of power the tool.
Someone else asks, I am in Utah. There is only one operating SBHC in Utah in the Southern County. I'm wanting to start an SBHC in Northern Utah. What indicators do you think are most compelling to healthcare facilities wanting to sponsor SBHC?
Good question. All right. So That's a great question. So, and I would answer it in a variety of ways. I think, and we would love to work with you specifically to dive deeper into this question. But I would think about what are some of the top health and education needs in your state. Is it substance use? Is it mental health? Is it obesity? Is it teen pregnancy? Is it vaping? Think about the landscape. Look to publicly available data like the YRBS data or the Robert Wood Johnson County Health Rankings and Roadmaps tool. Those public resources can help share publicly available data on what are some of the highest health-related needs in a particular state, and that might be the best place to start from sort of a data-driven decision making. I think the next step would then be to put together a group of people. It might be very local. It might engage partners such as Medicaid, Title V, the Department of Education, school districts, school principals, whoever, depending on how local your strategy is going to start or how broad you think it would be useful to start, to zoom in, to bring in the right people to say, we have this health need. It's not being met in our counties, in our state, in this region of our state, and we want to explore school-based health centers as a strategy to start to address this need. You can also obviously use the data that's in the tool under our indicators. If those indicators resonated with you as ways to identify areas of need in your state. I'm going to quickly go ahead and show you, based on the data that's included in our tool, where the highest or areas of need are in the state of Utah. And it looks like it's in the southeast corner, but that doesn't mean there isn't need up here in the northern parts as well. I would encourage you to click here on the data and analysis, limit your analysis to the counties in northern Utah, and start to develop a descriptive picture from a data perspective of what the challenges are in your state. And then from there, we encourage you to reach out to us at the School-Based Health Alliance to help think and strategize about what it means to start a school-based health center and what the steps you should take are to opening them. There's tons of opportunity across the country, including in Utah, to expand school-based health centers. And we're here at the Alliance have a lot of content experts who can help you think through what steps need to be taken to start a health center.
Another question is, can additional databases be added to the set you currently have, or are we maxed out on space? For example, if we wanted to add school-aged and facility condition data, could we?
We can add as many indicators to this tool as we would like. We can add as many filters of data to this tool as we would like. And we want the data that's in this tool to be driven by the users. And so if you have ideas of additional data sets that you would like to see added, please send them our way. We can work with Health Landscape to build those indicators into the tool, or those filters that might help you, that might be filters and data sets that other people are interested in as well.
Okay, great. We have a couple more questions. Haley, is that okay?
Go for it.
All right, someone says, I'm from the Missouri State Affiliate and wanted to reiterate that we do have numerous telehealth programs / sponsors in our state. They just have not yet been captured through the national census. You're welcome to reach out with me with questions at miming@moschoolhealth.org.
Oh, fantastic. Thank you for that feedback. And yeah, we would love to learn more about the services being provided and to update the data. We use the National School-Based Healthcare Census as the data set to describe the characteristics of school-based healthcare. We do the survey every 3 years right now. Our next survey will be for the 2019-20 school year, so the school year that is underway. We'll be launching the survey toward the end of this school year. So please send us that information now. But in terms of our process of updating data in the tool, right now we update it in alignment with each of the census reports.
Okay, and the last question is it better to start the dialogue about SBHC with the healthcare, education, or political system?
All of the above. All of the above, and all relative to your community. And it might be that I don't know where you're starting from. It might be that it's worth, I'm interested in what state you're from. And so if you want to put what state you're from, I might be able to make a more specific recommendation. Oh, from Utah, okay. That's great. So we can connect you here to other individuals in Utah who are working in school-based healthcare, or you can look on the map to see where those school-based health centers in Utah are, and those other school-based health centers, which I believe there are only a few, they might be a great starting point to ask your first questions, because they have already started a school-based health center in Utah and may have an understanding of the landscape, and they might have ideas that might help jumpstart your initiative. But then I would think about your community and who are the partners that come to mind immediately when you think about school health services. It might be at a very local level that you have a relationship or an interest in a particular school, and you start with the school principal, or you start with someone at the school district level, or you might be familiar with a health entity or perhaps a federally qualified health center who is in your community but isn't delivering, doesn't have any school-based health centers. You might connect with the Utah Primary Care Association to make connections with federally qualified health centers in the state of Utah and explore whether they're thinking about schools as places to provide health services to children and adolescents. If you have connections with the state legislature, that's fantastic. Maybe the State Department of Health, Public Health, Education, Title V, all of those individuals could be valuable for starting the conversation. And then we would encourage you to reach out to Tammy Alexander with our organization, and we can share her contact information. She leads our state affiliate leaders and is really familiar and has expertise with sort of the state level landscape, and may be familiar with other folks who are trying to generate momentum in your state or close by in another state.
Thank you so much, Haley. And also my colleague Maddie has included the Missouri SBHC telehealth information, also the information for Tammy Alexander that Haley was just speaking about. And once again, we thank Haley so much for this amazing webinar and all of your awesome questions. We do have a few questions for you. So we're going to launch the poll, as you can see on your screen. So you can just please take a few moments to answer the question. Also, we have on our slide Haley's contact information And we will definitely send all of you a follow-up email with more information, how to access the mapping tool, and additional resources that we will provide to you. This information will be uploaded on our website in 1 to 3 business days, and we will provide a link for you to have access to that. And once again, we thank Dr. Love, our Vice President of Research Evaluation at School-Based Health Alliance, and all of our attendees, and we hope you all have an awesome day.